Yes, all MPS patients, and especially MPS 2 patients, have lots of problems with ear, nose, and throat. And of course, again, very early in their lifespan, because of the enlarged tonsils and adenoids, they have obstruction. They are snorers. Sometimes they have apnea. We call it obstructive sleep apnea syndrome.
Due to the heterogeneity of the disease, not only the severe affected patients with behavioral problems, but we have also Hunter patients that have no cognitive involvement, but severe physical signs and symptoms like severe contractures, hip problems, carpal tunnel, heart involvement, respiratory problems. So what you see is that they look different from their families. This is something that you can really realize. The parents and the siblings look totally different. And sometimes they have a little bit enlarged head, and the face is a tiny little bit more coarse than in the other family members.
These diseases do not have a specific, single, very precise symptom that is leading to the diagnosis very quickly. The symptoms are shared with other common disorders, the ear infections, the delay in the development, the moving, the skeletal problems are very common also with other disorders. If someone does not know this disorder, they will never suspect.
I mean, we have to imagine that for families, it is extremely difficult to have a child that is not healthy. There's sometimes other siblings, and they have really to take care of not only the healthy siblings, but also of this child. And this child needs a lot of time and cares.
It's a very tough situation for a family. Before the diagnosis, because it's very troublesome. They take their kids every second week to an ear, nose, and throat surgeon, then a pediatric surgeon, then pediatrician, maybe an orthopedic surgeon, because of the different manifestations of the diseases. And that's why we should be a part of the multidisciplinary team, because I'm an ENT surgeon. I don't know really much about the background of the disease, the molecular manifestations. I cannot tell them, but a colleague of mine from the Department of Metabolic Disorders can do so.
But first of all, when the families find a diagnosis, they are more relieved, whatever the diagnosis is, because at least they have a name.
For parents, the most important is to find a diagnosis, to know what you have to deal with, to know which is your expert, which is the patient organization. You have the chance to connect with other parents to understand how to manage in the best way your child.
We should be aware of rare diseases, and specifically MPS, of course, because having a couple of tiny little pieces of knowledge really helps a lot in diagnosis and being a part of the treatment of these patients, and this is very important.
These are multisystemic diseases, and you have a lot of chances to improve their quality of life, and also you can really cover the life-threatening disease complications. But these are progressive diseases, and the sooner you make a diagnosis and you start even symptomatic treatment and physiotherapy, speech therapy, they need hearing aids, corsets, orthoses, glasses, whatever. The earlier you start treating the symptomatic features of the disease, the better is the quality of life of these patients, and they have a diagnosis and they know what they have to do.